Hello, everyone. My name is Dr. Chernykh, Volodymyr. It's a great pleasure to be here today, right in front of you on the scene. So today is only the first day of this journey that we called Symposium in KK, starting on the 4th until the 5th, 6th, 7th, 8th, right? And this will be a few days full of cutting-edge science and top-notch facts about integrative, biological, regenerative medicine, and so on and so forth. Some of you might be tired, but it's only second half of the first day. We have a lot of things to do, ladies and gentlemen. And my today's speech is called Collagen Crossroads, where the skin meets bone and aging and health. The reason why I decided to pick up this particular topic it's just because, tomorrow we are going to have a complete day, full day, based on the facts and on pathophysiology and biology of skin, bone, of bone health and aging. And today I kind of decided, since I am a dermatologist and aesthetic practitioner, I decided to find certain crosstalks in between these two organs, which are, of course, consist of connective tissue, which basically create the entire platform, why we can look into these organs and why they might have certain similarity in a way in a biology and the pathophysiology. Who am I? I'm a dermatologist and aesthetic practitioner, so I'm also a researcher, nutritional therapist, author, with 12 years of experience, not only dermatology and aesthetic practitioner, but in regenerative medicine. And it's been a long journey since I met our technical consultant, the founder of the company, Dr. Volodymyr Chernykh. And since then, we've been working, with pretty much our effort and still continuing. And a lot of things, believe me, Dr. is never wrong. There are a lot of many things will come pretty much soon. And a lot of things we have to share within these 4 days. All right, so my objectives today will come out from the outline. So I'd like you, and obviously you will be able by the end of the lecture to find out what's the ECM and what are the ECM components for both bone and skin. We'll look into the examples of ECM structure and functions of these both organs. And then, well, not surprisingly, both of the organs, they share similarity in factors and causes that may insult the ECM. And we will look into the possible interventions and dedicated treatments that can help us to fight with the aging of the skin and bone. Once again, I'd like to say that since tomorrow we are going to speak mostly on the bone health, so my today's topic will touch more on the skin health. However, we'll find those collagen crossroads and so on and so forth. So the skin is the biggest organ in our body. It has various functions. It has 3 layers. The outermost, which is called epidermis, is the functional organ. It's the waterproof kind of protection organ. That's what we see on the surface. Beneath it, located the dermis with the tough connective tissue. It has sweat glands, and if we go down there is a fat, so it's it's basically fat connective tissue, and it's something that we would like to get rid of, and some of us really want to, but at the same time it's like our basis of survival and cushioning sometimes. Yeah, so of course there is no possibility to think or contemplate on the ECM without thinking of the cellular components of the skin. And if we look into the skin, of course, once again, I'm pointing now to epidermis. Beneath it, the cells that are producing extracellular matrix. That's mostly fibroblast, of course, and the integrity of the tissue is created in the dermal epidermal junction by keratinocytes. And here we look into all the collagens, elastic fibers, glycosaminoglycans, and so on and so forth. So it's a quite a dynamic, very sophisticated structure, and they are both interrelated. So we have 4 main types of tissue, four types of tissue in our body, and whether it's nervous, epithelial tissue, muscle tissue, or connective tissue. But of course, today we are mostly interested in connective tissue. and something there is in between of all these tissues, which is called extracellular matrix. Now it's a time to define what extracellular matrix is. And so first of all, it's a composition of non-cellular component, because the cells are producing it within all tissues and organs, and it provides not only scaffolding. We have to understand, even though with integrity of the every organ, all the cellular constituents, they also initiate plenty of different crucial biochemical and biomechanical cues. Biomechanical, please remember, it's important for our today's lecture, and it's all required for us to promote morphogenesis, differentiation, and homeostasis of any given of any given organ or tissue. And when we think about ECM composition, like for example, in terms of sub-organ, like we usually, well, possibly just because I'm a dermatologist, we usually think it like, while thinking about connective tissue, I would think about the skin. But of course, since both organs, skin and bone, they are basically have a structure that is based on the structural components that you see on the screen. Well, of course, bone doesn't have elastin, but this highly dynamic structure will share similarities. And so it's not just they have like structural similarities. All this constituents, all these tiny parts, they will be highly dynamic, promoting homeostasis, differentiation of the tissue, and promoting all these functions that you've seen on the previous slide. So it's a myriad of different kind of complicated, of course, especially from the at a glance things. However, there is one hero in connective tissue. I would put it in kind of a layman language, which is collagen, of course. We have up to 30 types of collagens in our body, with the type 1 the most abundant. And there are various types of collagens in our body, and of course, architecture promotes functions of any organs. We'll look into the skin. It might be that's something that collagen makes tendons, bones, and skin, just because of because of the difference in the ECM structure. Of course, they will look differently and perform different functions, of course. However, type 1 is the most abundant, and in the dry mass of all our body, it's about 30% of this particular collagen. In the skin, it is impossible not to mention elastin, which is also abundant. It's stretchy and resilient protein in our body. That is something that creates elasticity, and that is something unavoidable to promote and stimulate when we want to get rid of certain signs of aging. So elastin is crucial as well. Third biggest protein in our body is fibronectin, and it is related to the class of glycoproteins. So it's all arranged into the mesh of fibrils, similar to collagens, and it is linked to some receptors, whether it is on the surface of the fibroblast or whether it's surface on the osteoblast. So it's connected to the receptors that are called integrins, and the integrins are quite important receptors, I would say, since they're involved in mechanoregulation, and without the mechanoregulation, impossible for any given organ to develop, and it's impossible for the stem cells to cell migrate. It's impossible for the stem cells to develop, migrate, and differentiate, and so on and so forth. And laminin is also part of the glycoproteins, and it works as a basement membrane. Slightly later, I will show you what is that. And then we have another structural component, which components which are proteoglycans, and they have various set of functions, I would say. So, but the main function and the main function behind is that they can provide resistance to compressive or squaring forces, buffering, hydration, and binding. So, and they are comprised of glycosamine glycan chain and of repeating disaccharide structures. GAGs are negative in charge, and they have the beautiful capacity to retain water in any given organ. Just because all of us are comprised of 60 to 70% of water, and this is due to glycosaminoglycan, we can, remain the shape. Possibly kind of in a layman understanding or how do we maintain the shape, we can maintain it only because we have those wonderful glycosaminoglycans. Otherwise, water would, travel all the way to the ankles, and we would look as a kind of a pear-shaped creatures, I would say like that. So glycosaminoglycans in a way are important. And then, yes, one of the most famous glycosaminoglycan is hyaluronic acid due to its capacity to retain plenty of molecules of water on its surface. And as I said, it is a myriad of different components. Sometimes when we are just like practicing, we are meeting the patient, we are looking into the science of aging, when we don't think about all the CCM components. But at the same time, it's quite interesting to find out like what's there behind, and understanding better helps us to become better professionals in the field, and so on and so forth. So proteoglycans, they're also they are surrounded by those growth factors around them. It is quite important, just because all these growth factors, these are basically those soluble factors that we discuss when we talk about NOP peptides or mitopeptides. In a way, of course, they stimulate paracrine effects when we're stimulating and when we're injecting peptides. Or this can be cytokines or other molecules. And of course, it's impossible to think about the aging without having some bad guys, some SEM regulators, which works as like for cross-linking. That is something that we like to avoid. And this is a different type of collagenases, oxidases, different type of enzymes. And one of the most prominent in the connective tissue, this is matrix metalloproteinases, and they're inhibitors. So and in different types of tissue, metalloproteinases, they work, so they can be kind of a good guys, they can be bad guys at the same time. We have a spike of matrix metalloproteinases immediately after having, like, for example, if we are exposed to the sun, and that is something that basically helps to destroy the proteins in the skin as well, and leads to cross-linking of the different proteins, or elastosis of elastin, for example. So once again, role of extracellular matrix is crucial for our body. So first of all, of course, it's create the scaffold, it creates this tissue integrity, and then promotes and stays as the background for architecture and function. It is impossible not to think about the microenvironment that is happening in the ECM, since it's as I tell, it's a place where all the growth factors are. So the cell proliferation, migration, differentiation wouldn't be impossible if we didn't have ECM. At the same time, and the crucial thing for us to understand the process of aging, both in skin and the bone, this is mechanotransduction, just because skin and bone, these are two organs which are highly involved into the remodeling, and it's something that we don't really pay attention, or we just don't even understand, just because it helps, because it happens biologically. It's a natural biological process, but without all this process of outward and inward pulling of the between the cytoskeleton and the different proteins outside of the cell, it would be impossible to understand the process of aging. For those of us who'd like to visualize the process better, just because like I'm not one of those persons who can't really pick up something from the words, I would like to invite you to watch a short video about the ACM and functions. It will give you a little bit, possibly, a better understanding of what happens. So please appreciate the short video.
It is often thought that tissues within our organs are a tight compaction of cells, where in actual fact, they are usually more spread out. Between the cells is a complex support network comprised of proteins and carbohydrates called the extracellular matrix, the ECM. The main role is to protect and support cells, like the way items are protected during delivery by packing them with wads of paper or polystyrene scraps. Yet this is where the analogy falls apart. The ECM is a highly complex and provides many more functions than just protection. These include providing a scaffold to regulate correct function and shape of the tissue, influencing the cell's behavior in accordance to the changing environment, and regulating cell-to-cell communication between adjacent cells. Just as the tissues in our body differ, so do the components of the extracellular matrix. Each composition is adapted to the needs of the environment. This can be hard and calcified to form bone, or soft and elastic, as we find in our lungs.
Or skin.
But how does the ECM know which components to use, in which tissues, at which time? The components are actually produced by local cells. They secrete specific products, defining the specific characteristics of the ECM to best fulfill their role in the tissue. In most tissues, ECM ingredients are secreted by cells called fibroblasts. However, in more specialized tissues, these fibroblasts come in different flavors, for example, osteoblasts in the bone. Yet all ECMs share three common components: an extensive proteoglycan network in green, chains of cross-linked fibrous proteins in blue, and cell receptors called integrins in orange. Firstly, the proteoglycan network comprises of sugars called glycoaminoglycans. These long polysaccharide chains are attached to hundreds of core proteins, with each protein having many similar smaller carbohydrate groups attached. They exist as a compressive filler substance to protect cells, as well as storing many cellular growth and immune activating factors. Secondly, the fibrous proteins are embedded within the proteoglycan network to form the basis of the structural scaffold. They also help attach the ECM to other nearby cells. The two most common constituencies of this group is collagen and fibronectin. Collagen is a strong triple helix protein comprised of two identical chains and another that varies only slightly. The variation of one of these chains defines the type of collagen this is and gives it slightly different properties. The collagen fibers are interwoven within the ECM to form a basket weave. Fibronectins come together to form insoluble fibers between cells. They bind collagen and integrin on the surface of local cells to allow stretch-mediated cell-to-cell communication. Finally, integrins are cell receptors that span the membrane. Within the cell, these receptors bind to microfilaments to convey stretch and pull messages to the cell to change behavior and respond to the local environment. On the outside, they are connected to the ECM to also allow cells to send and receive messages. These integrins are also classed as part of a group known as the cell adhesion molecules and help cells stick together in the ECM and hence together. During contractions or movements of the extracellular matrix, the integrins rearrange the internal microfilaments, which send signals to the nucleus to turn on or off certain genes which allow the cells to adapt to the behavior of the changing environment.
All right, so here you see the cell in 3D picture of the ECM. So, and the one that you see here in the middle, so there's something that is called interstitial ECM. So this is basically something, all this complex of proteins is creating, so the main function is scaffolding. And the outside part, which is basement membrane, you see it looks like a mesh. You know, so it has a function of separation of epithelium from the stroma of the organs. And well, when we think about the cell or about the egg or about the chicken, I would usually say that the dinosaur comes first. But when we talk about the cell or about the extracellular component, I'm sure that this is the cell. So at the beginning of the development of our epidermis, dermis, or hypodermis, we see it's only just a few cells. But during the life, so starting from embryogenesis, the extracellular matrix becomes the most abundant. And of course, during the life, here comes the maturation, and there is a some process of degradation, of elastosis, fragmentation, and so on and so forth. And at the end, of course, we are having the process of atrophy of the elastin network, decrease of collagen fiber, and so on and so forth. And similar processes, believe me, are happening in bone, but most of them, of course, we will discuss tomorrow. Also, I'd like to point your attention that every given organ, whether it's organ and connective tissue or any given tissue, will have a particular so-called proteome, the number of genes of a particular type of ECM molecules, which will be absolutely and very strictly linked to any given organ. It will be slightly different in agents, well, it will be different in aged type of tissue. So, and with the increased ECM stiffness and so on and so forth. The end process of any, let's put, soft organ will be something that is called fibrosis. And with the increased ECM stiffness, there will be it will start this vicious cycle of the overproduction of ECM and then of ECM components. And that is how the situation comes even worse. In wounded or fibrotic tissue or in trauma of the bone, there will be increased numbers of low molecular hyaluronic acid, since it's one of the signs of the inflammation. Will be some increased level of collagen types, which are kind of trying to separate that wound or trauma. So it's all very complex, and there is a huge research in how like ECM stiffness also involved in the process of tumorigenesis and metastatic niche as well. Once again, we are coming back to the collagen, and in both organs, whether it's in collagen in the skin, it creates about 80% of all proteins, and it's about 90% of all the proteins in the bone. And it has a kind of complicated structure. You see it's a kind of waving. So it consists of 3 polypeptide chains wound around each other in a triple helical configuration. Unfortunately, during the years, because of the set of the causes, skin and bone are becoming a subject to aging. So, and with the over the years, so the skin becomes weaker. We see the sagging of the skin and some laxity of the skin, and the same happens with the bone. It develops osteopenia, then primary or secondary osteoporosis, and so on and so forth. Why it also happens? Just because both organs, they share same pathways of degradation with the MMPs that I mentioned before. There are different, and once again, as I said when we were discussing MMPs, they can work differently in different organs. But at the central, of course, role in fragmentation and degradation of both organs, it's a collagen fragmentation. That is why both organs are sharing the same pathways of degradation. And as we saw in the video, both cells, the mechanosensors in the skin, there's a fibroblast, and mechanosensors in the bone, there's a osteoblast. They're receiving this inward and outward. There is outward and inward pulling between the that goes through this focal adhesions, and this is those guys' proteins. So mechanic signaling goes into the nucleus through the cytoskeleton, and then there will be response by the cell. And so whether on production more collagen or more different kind of enzymes. And the same will happen. Osteoblasts will sense the kind of load bearing, mechanical weight bearing on the osteoblasts, and they will adapt. They will remodel the bone in a way that, like, the bone need to be stronger, and so on and so forth. And the same works in the conversely, when there is a fragmentation of this collagen. So if there is normal mechanical tension, so the production of collagen goes fine. But if there is normal procollagen synthesis and low or normal level of matrix metalloproteinases. But if there is a collapse of the fragmentation, there is mechanical tension will be low. There is no proper production of collagen, and at the same time there will be spike of the production of different kind of enzymes that will only aggravate and exacerbate the situation. So it's a vicious circle. The higher, the better is ECM stiffness, the faster we develop process of aging. It happens because of the different, of course, causes either for the skin or for bone, but at the same time, most of the things like cell senescence or telomere shortening, mitochondrial DNA damage, have similarities. Especially important for the skin is the ECM hydration, which comes from the glycosaminoglycans and hyaluronic acid, because it's important for differentiation and migration of the cell. As we lose the hyaluronic acid during the life, we lose the water and possibility for the cells to survive. Another huge player on the scene is the advanced glycated end products. So of course, because of the hypercaloric diet, or because of eating of the refined sugars, of the deep fried food, and so on and so forth, because of smoking, because of alcohol, our tissues can accumulate a lot of AGEs, and they are markers of aging. They will destroy it further, whether proteins or lipids in our skin. And so anything hidden with the flow of time becomes obvious. So we start to develop different signs of aging, whether there's wrinkles, or whether they're pigmentation. By the way, another one important thing that's kind of sharing similarity between skin and bone health, and that is something that Dr. Margot mentioned in her lecture, it is that, of course, there is a decrease in production of estrogen during the life, and then because of that, there will be the skin will develop skin thinning, and the bone will develop osteoporosis as well. So there's a shared similar pathways that lead to the degradation, final degradation of the tissue. And on top of that, of course, the bone is a process of bone resorption and the osteoporosis. We will lose at the same time some fat tissue in our body. Muscle tissue will change. That is why we can observe, we can see that visible changes, whether on the face or anywhere on the body. And of course, it's just impossible. Could you please play the video? It's impossible not to correlate and not to connect both effect of the skin aging, skin aging and the bone aging as well. Just because since you see how the mandibular and maxilla is changing, and at the same time as the orbital rim is changing it. And that is what happens deeply. Of course, will have its personal reflection on what happens with the skin. So this, once again, bone and the skin are pretty much interrelated organs in terms of aging. And that is what basically happens by the end. So what are the tools, what we can use for to improve these conditions, to fight with aging? And tomorrow in my topic on osteoporosis, I will touch additionally on the different kind of phytochemicals that can boost and then improve the density of the bones, but at the same time we take certain whether polyphenols, whether tannins, or different kind of molecules that can be included in creams or cosmeceuticals that can decrease the level of collagenases, and that's why different kind of plant inhibitors can be used as anti-aging agents. One of the products that I generally include into the protocols for the skin treatment, it works really well in combination with, most of the patients who would like to avoid certain products because they're vegans or vegetarians and they would prefer to have plant-derived products. So this is the combination of from Swiss Natura Phytomyco brand, which once again can be as a part of the complex protocol, which has ingredients red clover, Breckland thyme, field horsetail, damask rose, and tulsi. I've also made a certain research and collected the data about ongoing trial in the field with primary endpoints specific to ACM stiffness. There are not that many trials that are ongoing particularly for skin health or bone health, but as we can see, so the ECM, the therapeutic interventions are developing in the field, so at least there are certain already of them in phase 2 or 3 for melanoma, multiple myeloma, some cardiovascular disease, and so on and so forth. So basically what I'm trying to say that the science is developing, and possibly pretty soon, except for some of the molecules, active agents that we have currently at the market, will have much more, and with basically therapeutic agent that can have certain action on the SEM stiffness. Here I collected certain molecules that can also both improve the skin and improve the skin health and the bone health as well. So some of the molecules can work both in the field of skin and bone, like for example, like resveratrol, quercetin, curcumin, and so here also it's important. So some of the data will take in from the animal studies or from human studies. Here comes once again vitamin D, which is because it's both crucial for the retention of the calcium in our body. It's impossible to do without vitamin D. One of the well, it's not even, like, we have to be honest, the product that can help the skin or bone health. Vitamin D is crucial for our immunity and so many other functions. I believe about 70% of most of our patients whom we give advice after 40 years old, they will be usually deficient one vitamin D, no matter how sun exposed you are, and so on and so forth. And then we should remember that it is fat-soluble vitamin, and most of our patients who have some metabolic syndrome, who are overweight, they're usually also depleted on the numbers. That is why, whether you want to support the patient with some deficiency of vitamin D, and just you're thinking about the possible integrity of the skin just because you want to stimulate keratinocytes, improve their proliferation, so on and so forth, or you want to, just because we know that, I mean, it's an obvious thing that vitamin D also helps with such condition of the skin like psoriasis, atopic dermatitis, and so on and so forth. So oral intake is possible, and at the same time it will be also crucial for taking it for the bone health. Now, there are also trials that are going in the field of oncology with targeting extracellular matrix, and I believe it will be developed even more. Now I'd like to point your attention to what are the main strategical agents that can work for the health of the skin that most of the aesthetic practitioners and dermatologists use in their practice constantly. So these are topical retinoids, these are cosmeceuticals, including some of the plant inhibitors that I mentioned before. These are peptides and growth factors. We can also say that this is mostly the agents that are stimulating the pericrine effect. These are dermal fillers and lasers and other novel devices. Here I haven't included any interventions for bone treatment, since we are going to discuss them tomorrow. Now, talking about the topical retinoids, of course, like this is a magical molecule. The vitamin A derivative, it's a great, very powerful molecule. It works, it goes to the nucleus and produces a lot of different effects. It's stimulating collagen, and you can't overappreciate how topical retinoids work. If you start to work with the skin, like, best to start with the lower percentages and then increase them slightly. And even with whether it's a serum or whether it's a cream, it works brilliantly for the health of the skin. You can start it as early as 30 years. Some people start slightly later. Here comes the hyaluronic acid fillers. And once again, it wouldn't be possible, well, I will touch a lot on it on the third day of the symposium, the conference. There I will discuss more how we use the fillers for different layers and so on and so forth. But we have to once again remember glycosaminoglycans, hyaluronic acid, retention of the water. We can first to improve the hydration of the water, the way of the skin, how the skin looks like, just this radiance and complexion, and at the same time, hyaluronic acid will stretch the extracellular matrix, so it will bring all this, so it will promote the stretching capacity of the fibroblast, and that is how it will also stimulate the production of collagen. So among the other cosmeceuticals, which are the most prominent, this is vitamin C. At the same time, this is a different lactic or glycolic acid fillers. They can also hydrate the skin, and as peptides or exosomes. Here I just would like to show you a few examples of different kind of peptides, and they have different functions. Of course, they have high biological activity. We can inject them, we can sometimes drink them, and they have a huge, and they have wonderful biocompatibility with the tissues. Now, there are two main types of peptides that I'm using in my practice. So whether this is an NOP peptide, so some of the speakers have already touched on them before. So there is a kind of, and once again, on the third day, we'll look more precisely and more profoundly into it. NOP type of peptides, which were actually one of the first peptides that the EWBG came from. It was at the beginning of the 2000s, and that is wonderful, pretty active, pretty efficient molecules, and they're tiny ones. So you can, with the for the skin, you can do even topical treatments using them, which is wonderful. It creates a lot of possibility for treating the local wounds and so on and so forth. And they stimulate. You can have faster effects, like exactly what something that Dr. Glenn said in the morning. So you can have the fast results, but they, for example, they won't last as long as mitoorganelle peptides, which is something that company came up with about 8 years ago. So this was the revolution in kind of in the peptides field. So we've added a bigger fraction of mitoorganelle peptides into the vial. So, and this is complicated, not complicated, but it's a sophisticated product of biological engineering, just because the mitochondrial peptides, they stimulate all those functions that mitochondria are responsible for. And the mitochondrial dysfunction, of course, it's a major thing, and whether it's bone, collagen degradation, or skin. So, however, so I would say that particularly for the skin aging, we would use mitopeptides for the age of 40 years and older, just because they have a bigger molecular weight. The onset of the effects will be slightly postponed, but at the same time they will have a longer lasting effects. This is some of the results. So whether we can work with the wrinkles, and it's best to do the combination with the treating the either stretch marks or the scars. Possible to do on its own. It will be improved, but I personally like to do it with the laser resurfacing. Also, another thing is a topical application of peptides, like for example nanopeptides, give us an opportunity to improve different kind of ulcers. And this particularly we did with Dr. Simon. Isn't it, Dr. Simon? That's who will be the next speaker. So we use some topical intradermal injections, and usually this is highly, gout ulcers that are highly metabolically very, stubborn ulcers. It's not easy to treat them, just because like the uric acid will be accumulated in the ulcer. So it's pretty hard to get to the point of epithelialization to really start to boost the effect of local wound healing. But we managed to do it like much faster if we've never used any other additional agents. So by the topical and intradermal injections of placenta peptides and mesenchymal peptides, so we managed to have a full epithelialization of this huge ulcer only in 3 months. Of course, we use like some disinfection in between the sessions, but still the effect is great. Here is the case of using of nanopeptides together with hyaluronic acid, and I like this combination. So this lady, she had a bunch of different problems before. So some forehead wrinkles, some tiny little wrinkles under the eyes, and the skin color complexion was also different. Here you see still the signs, some little bruising after injection. I guess like I took this picture after 3 days. What peptides provide? Of course, like any professional have to be responsible to use as multimodal, multi-complex protocols as he or she wants, just because this is how we become better professionals. But peptides is usually like I wouldn't start any other protocol without adding some nutrition for the skin. And peptides, they're working as a natural healers, just because I mean this is pretty much natural treatment. And so all this complexion, all this radiance, we can achieve pretty much good with the work of peptides. So this gentleman didn't have much of a problem. Let's be honest, right? Just some forehead problems. A few forehead wrinkles. That's it. But just with the 3 treatments, we got rid of them. Whereas this man got massive wrinkles on the forehead, and also with the 5 treatments, he started to look much better. And once again, that is how natural looking skin becomes after just having one mesotherapy on this hand. I took this picture after 3 days, and please compare it to that one where there was no treatment done. You can still see the little crust after the injections. So that's how skin becomes different after just one injection of peptides. You can, of course, and you know, we are interested, like after finishing the lecture, any given lecture, you can find and go to the booth and to find out more information about our publications, as we mentioned it today. So last year, in one of the books that we published, it was Minimally Invasive Techniques in Daily Practice of Anti-Aging Practitioner. And this book combines some protocols on female reproductive regeneration and some protocols on it. And this book contains plenty of protocols and examples of injections, basically on skeletal muscular health. And on top of that, there is a chapter include on mesotherapy, whether it's like anywhere. Mesotherapy is basically the way how can we regenerate the skin, and this chapter was written by me. So all this information is here. It's a brilliant book. Please pay attention to it, and like if you have a free time, please do read it. And so what are the other devices that we can use for the skin rejuvenation? These are lasers, this is radio frequencies, and this is HIFU as well. And you're the one, you're the master, you're the one to decide. And of course, upon the thorough, meticulous examination of any given case, like you can come up with certain tools, how you can accommodate, how you can tailor the best of those given treatments for any given patient. So plenty of things to choose. On top of that, we shouldn't forget about the easiest thing. Of course, we can do, you know, especially like if you treat metabolic syndrome or anything given, we shouldn't forget, aside of all these tools, we shouldn't forget about healthy diet, about physical activity. For the skin, it's absolutely crucial to have enough intake for any one of us. And for skin, it's also impossible. It's like you can, of course, get a bunch of supplements, but it's impossible not to protect your skin with the SPF protection. And here comes also the connection between something that works also for both, for skin and for the bone, just because without gut microbiota, without a normal functioning, which is eubiosis, when it's come to dysbiosis and we don't consume enough probiotics and prebiotics that connect, that doing really good work together and work as symbiotics, we can't have a healthy skin. And at the same time, we will touch on it tomorrow, because of certain problems, without not having those probiotics, especially lactobacillus, bifidobacterium strains, and without having some prebiotics that work as non-digestible fibers that feed those bacterial strains, we can't have healthy skin. And it's also because of the slow-grade inflammation, because of the increased permeability of the gut. It's hard to think about the healthy skin, and that is something that lays behind certain conditions, like, for example, like atopic dermatitis, or whether it's rosacea, and same time it works in a similar way with the bones. but we'll talk more about it on yesterday. And the last thing I would like to emphasize on, pretty often people ask me whether the collagen ingestion helps or improves the skin or not. And it's like, it's pretty easy to fulfill this gap of knowledge, since like we can believe or not believe certain facts, but when we look into the data which is done by prospective randomized controlled study, you can possibly believe it. So, and in this particular trial, it is reflected that daily collagen supplements, it improved the hydration of the skin. In another PubMed review, which is contained systematic review of 11 different trials, it also confirms that skin condition can improve, and whether it's aging of the skin or whether it's wound healing, so it's improved the hydration and fast epithelialization of the skin, I mean the daily consumption. And another trial from the University of Kiel from Germany also says that whether in ingestion and daily consumption or the collagen tripeptide or collagen hydrolysate can help with the improvement of skin elasticity. And that is something that I also include into in the protocols. I also have some videos created based on the collagen. So just intake of 2 supplements a day on the empty stomach will improve the skin condition. Of course, you won't have like a, terrific changes in the skin condition. It's something that, like, has to be taken for a long time to maintain, to hold this condition. And in combination with all the other treatments, that one can lead to perfect success at the end. Here at the end of the lecture, I'd like to say that, possibly that ECM is the forgotten child of biological regenerative medicine. It's pretty interesting that for us today, and one of them, Natalia Shishkina, she was talking about this crossroads between diabetes and osteoporosis. So I found it that's pretty interesting that ECM provides us example of the structure and how function relates to the, how structure and function all can be interconnected, whether in skin or the bone. And at the same time, we found out that many similar insults can lead to the deterioration of both organs, whether it's bone or skin. At the same time, some trials are ongoing, and but I always believe that more research is needed when we will get to the point that even SCM is targeted properly. I think we'll be happy ourselves, and we will make happy our patients as well. So once again, we have plenty of publications. Some of them can be seen. Please go to the booth. We can, once again, we are all here for 4 days. If you do have any questions on about what we've just discussed, we are always happy to discuss it. Publications are here. There are about 130 publications, and so on and so forth. And at the same time, if you'd like to go more, all the QR codes are here. Thank you very much for your attention. It's been my pleasure.